know that even if you wore bifocals, you can actually get bifocal contact lenses? Well, here to tell us all about the bifocal contact lenses is optometrist Dr. Jeffrey Schultz. Welcome back to the show.
Good morning.
All right. Doctor, why bifocal contact lenses?
Well, again, we go back to the question of vanity. People wanting to wear or not wear their glasses, and the contacts can solve that issue.
All right, well, let's take a step back real quick. What does bifocal mean?
Well, if we take the term and separate it into its two separate parts, bi means two, focal means focus. So two focuses, focusing for distance, focusing for near.
All right, well, I know the last time you were on, we talked a little bit about presbyopia. Can you talk a bit about that again, please?
Well, when we're 7 or 8 years old, our eyes have their best focusing ability. And from there on, it's downhill. We get to approximately age 40, somewhere between 35, 45, we start having near focusing problems or inability to sustain that near focusing. And we're sort of stuck. We cannot read, we cannot do things, and as we get older, it gets worse.
Well, you know, contact lenses, they are so small. Is it even possible to have more than one prescription in that one little contact lens?
Even a contact lens that's less than a ½ inch in diameter can have more than one power, so yes.
Well, if you have all different kinds of bifocals, do they all perform equally?
No. Bifocal contacts are available both as soft lenses and as gas perm, and each have their own pros and cons.
All right, so there are, how many different kinds are there?
Lots.
Lots of them.
Lots of them. Soft contact lenses are great. They're very comfortable, but they only really apply to people with small amounts of astigmatism. And we're sort of stuck.
Well, you just brought up an important word. What is astigmatism?
Astigmatism refers to the cornea being out of round. The front surface of the eye is shaped more like a football or the back of a teaspoon than like a baseball. Astigmatism means less or more than one point of focus.
Well, I thought are there soft lenses for astigmatism?
Right. There are soft lenses for astigmatism. There are very good soft lenses for astigmatism, and there are very good soft lenses for presbyopia as a bifocal. But the problem is there are not good soft lenses for presbyopia and astigmatism.
Which brings us to the rigid gas permeable bifocal contact lens. Talk about that, please.
Big mouthful.
Big mouthful.
The gas permeable lenses, which have been around a lot longer, rigid lenses have been around more than the soft lenses. The original bifocals were uncomfortable, a lot of problems in designing, comfort issues. Patients were unhappy, and when patients became unhappy, the doctors became unhappy, and they sort of fell into disfavor.
So do they really work?
They do. They've come a long way. We now have new methods of doing and fitting lenses. We have a new instrument. This is called a topographer, and we're able to measure the cornea shape in a very exacting fashion. We have now able to take a contact lens. In the past, when we fit the lens, the instrument we used gave us 4 points on the cornea to make a measurement and to design the lens from those 4 points. An instrument like this measures 14,000 points, significantly more, obviously, and it allows us to look at all the various minute shape changes of the cornea, giving us an exacting fit and better optics, and able to design a lens with better distance and near acuity.
So this is how you solve the dilemma?
This is how we solve the dilemma. It gives, very few offices have a topographer, which is this type of instrument. There are others available which will measure the shape of the cornea, but this one here goes one step further than just measuring the shape of the cornea. It actually has the ability to be linked via the internet to the manufacturer, and we can then design the lens specifically for that patient right into the instrument that makes the lens itself. So with using an instrument like this, we are able to design a more comfortable contact, better fitting contact, better acuity distance and near, and have happier patients.
All right. Well, doctor, as always, great advice. I greatly appreciate you coming on. Have a great holiday, you and your family. If you want to contact the doctor, just give him a call at Lifetime Eye Care at 216-581-8484 or go to his website, myeyedoc.com. Coming up on Good Company, we're going to be talking about what